It's never too late to treat hyperhidrosis. The key point in hyperhidrosis is understanding that you have it and where to go in order to be seen. Being seen by a board-certified dermatologist is a great step in getting that treated, to make the diagnosis properly, to make sure there's no underlying causes for hyperhidrosis. Once that's done, the next step is to determine how severe it is, and taking a detailed history in what treatments have been done, and to also kind of get clues to see if there are secondary causes of hyperhidrosis. Once that's done, and then to try to come about an understanding and a treatment plan for that individual that works with them. Milder cases, you're going to be able to maybe get away with more topical treatments and things of that sort, and that may work. But you have to try something and give it a period of time before determining whether it works or not. Once we've gotten to a point where we've tried something, it hasn't worked, then saying, okay, what's the next step to kind of go through? So each individual physician is going to have their algorithm of what steps they want to take and what sort of works with them. There's no cookie cutter approach to hyperhidrosis, because each individual is going to be different and each individual physician's approach is going to be a little bit different, but the basic principles are always the same. We kind of use treatment options that have been shown to be helpful in different combinations in order to get to a point where the patient feels comfortable in control of their hyperhidrosis. One more thing, there is no cure for hyperhidrosis that we know of as of yet. And what I always tell my patients about is there are ways that we can control it. And so I tell individuals that expectations of a cure for hyperhidrosis is difficult to do. Regardless of what you end up doing, you are going to be having to keep up with something. My big point that I always like to let my patients know is hyperhidrosis is treatable. It's very difficult to treat, but if we can stick with it, we can kind of come to some sort of a happy medium to be able to kind of help with their symptoms there. But the key understanding is that it is difficult and it does take time and effort by the patient. And what I mean by that is, if you're using a topical, that topical needs to be used in a consistent manner. If we're doing Botox, you have to come in and follow up with us every 3 to 6 months to 9 months in order to get your continued injections. If we have prescribed antiperspirants, you have to do that several times a week. It's not where you apply a medication for 2 weeks and it's all gone and you don't have to worry about that. So it is a maintenance aspect of it is important to my patients, and so I really try to educate my patients about the importance of keeping up with whatever you're doing, because if the expectation is that they'll try something and they'll use it for a period of time and it'll be gone forever, that's not reality. And unfortunately, if that's the assumption that the patient's going to take, they're going to be very disappointed when that doesn't come to fruition.